Dr. Henry, you've obviously mentioned that the public service is now required to be vaccinated starting in November. Many of those workers work in controlled environments, workplaces. We anticipate they already have a high rate of immunization within that environment. In a school setting, teachers are mainly working with those who are not immunized in the elementary system all the way up until 12. Why not send out a provincial purview to require immunization for schools? And if not that, what is your expectation? Are you concerned that some districts with lower rates of immunization will not do it themselves because it would mean there would be far too many in the system not immunized or not being able to work because of the mandate?
Yeah, that's a very good question. And these are obviously things that we've been talking through and thinking through quite a lot. And so as I've said several times, public health orders require certain conditions to be in place. I have to have reasonable and probable grounds to believe there's a health hazard. And there is that in a healthcare setting. And that's why we've focused on the areas where an order is needed in a healthcare setting. So it is a different situation in many other settings, including industrial camps, including absolutely schools. So we have been talking with the Ministry of Education, with union representatives, with our committee that we have, our school committee, and I know that the Minister of Education is looking at how to do this or how these issues can be addressed in an inclusive provincial perspective. And I don't know, Minister, if you wanted to talk to that, because I know there's been some ongoing discussions.
Thank you very much for the question, Richard. As Dr. Henry has said, the vaccine mandates by public health order are healthcare, and they relate to healthcare. And of course, there are hundreds of people in the hundreds of thousands working in healthcare, including 50,000 who will see that order put in place on October 12th. We know there is a desire expressed by people in school communities for mandates in education, and as such, the Education Ministry, my colleague, Minister of Education Jennifer Whiteside, is immediately convening an advisory committee, an ad hoc one with BCPC and other partners to develop common principles, standards, and guidelines to support boards with the potential implementation of vaccine mandates. The committee will work quickly to get these materials to boards as soon as possible. If boards wish to explore a vaccine policy independently, we would strongly encourage them to work with BCPC and their local partners. In other words, that work is going on. In the direct public service, the direct employees of the public service agency, and this is a direction from the Deputy Minister, the head of the public service, Laurie Wanamaker. This has been put in place where we are direct employers, and we put this measure in place. I think it's an important measure to make people safe, and we're encouraging everybody in every possible way to get vaccinated.